Without an effective team response to crisis, the health and safety of both passengers on a plane and patients in a hospital are at risk. The healthcare community, including medical journals, have compared the safety records of aviation and healthcare, citing that in 1 in 300 hospital admissions resulted in death. Many have sounded the alarm and called for action and safer healthcare practices. With more than 6 million people around the world flying safely on commercial aircraft every day, flying is one of the safest modes of transportation. This has prompted a combined response by CAE Healthcare and the Faculty of Medicine at Université de Montréal in creating a program with the objective of increasing patient safety. What has emerged is a continuing professional development which leverages techniques used in aviation for advanced training and continuous improvement initiatives. Will these methods improve the situation for healthcare? Absolutely. The aviation industry's success with improving passengers' safety was realized by changing the way pilots are trained and the way team dynamics are approached. A new training methodology was implemented focusing on a wide range of knowledge, skills, and attitudes, including communications, situational awareness, problem-solving, decision-making, and teamwork. The end goal: improve passenger safety by creating an effective crisis management through better teamwork and enhanced situational awareness. To achieve this goal, the concepts of crew resource management and threat and error management were founded on an in-depth knowledge of human factors. Crew resource management, or CRM, focuses on cognitive and interpersonal skills needed to manage the situations present in flight rather than the technical skills involved in piloting the aircraft. Threat and error management, or TEM, focuses on recognition of threats, their sources, and their potential to become errors leading to crisis. A substantial body of evidence suggests that healthcare teams still have lessons to learn and implement with regards to the acquisition of the very same skill sets adopted by aviation many years ago. Healthcare associations and organizations have steadily come to realize that status quo in medical education is not addressing a majority of issues relating to team performance and patient safety. The 2008 Quality and Safety in Healthcare Journal suggests that within the current organizational care systems of medicine, unintentional harm to hospital and patients can be caused in part by organizational complexity, the reliance on potentially dangerous high-technology equipment, and a lack of systematic communication and team training. Within organizational care, there's currently a shift toward improving team effectiveness in patient care and safety by stressing the importance of work occurring at the team level. To achieve this goal, healthcare teams and their members need to better understand the human factors affecting them. This can only happen through an experiential learning of team dynamics. Traditionally, healthcare's goal was to act on illness and health maintenance. It now has another goal: to minimize preventable medical errors. Medical errors are plagued by issues similar to those witnessed in aviation. However, medical errors have not been addressed with the same degree of effectiveness. TEM and CRM, properly adapted to healthcare, provide an excellent strategy with a direct impact on patient safety. Medical care, much like aviation, depends upon a process being carried out by individuals with highly specialized expertise, each with distinct decision-making responsibility. Many accidents in these environments are not driven so much by errors made within a specific area of expertise, but rather breakdowns in communication or handoffs, which lead to a series of events that result in extended hospital stays, or worse yet, fatalities. A streamlined crew resource management system can significantly reduce the potential of such errors taking place. Crew resource management improves patient safety on 3 distinct levels: error avoidance, error trapping, and error mitigation. The training enables participants to identify potentially dangerous attitudes and then teaches behavior and communication patterns that address these situations in a non-confrontational way. Managing task prioritization, inter-team collaboration, communications for briefing and debriefing are just some examples of the best practice in aviation training that can be applied directly to healthcare settings. CAE Healthcare and the Faculty of Medicine at Université de Montréal have combined their aviation and healthcare expertise. They are at the forefront in the development and application of crew resource management and human factors-based instruction for healthcare. Together, they have developed a comprehensive program comprised of 3 phases: the E-Primer, the SimComp, and the E-Maintenance. ePrimer is web-based material focusing on building team competencies around a common core in crew resource management, threat and error management, and human factors. Asynchronous learning is allowed through a learning management system tracking progress and performance of participants, while providing educators a means of ensuring participants are prepared before starting the second phase. The SimComp is a simulation experience for small group workshops. It provides the opportunity to implement new techniques covered in the ePrimer, as well as to develop and reinforce team competencies. The SimComp enables and empowers groups and individuals such as general practitioners of family medicine and ER settings, anesthetists, surgeons, nurses, and respiratory therapists, as well as groups and individuals working in ICU, ER, and hospital wards for general hospital settings. The final phase is the e-maintenance, which creates and develops communities of practice by keeping collaborative and patient safety competencies current and consistent. E-maintenance sessions are created and updated from the emerging situations experienced in real life through these communities. The result is an education program that is constantly evolving to meet the needs of these communities of practice.
Well, what we've demonstrated in aviation is that by properly introducing the use of simulation and creating what is a realistic and safe learning environment can provide learners, either individuals or team players, with the right environment from which they can practice the knowledge that they've acquired, but more importantly, learn from mistakes, therefore continuously trying to drive to a better outcome on patients.
There are community of practice at the group level, professionals working together, improving general care of patients. But there's also a second level of community of practices where good attitudes and technical skills to respond to various situations, emergency situations, and specialists across the province can share experiences and challenges with the Simulation Center to develop new programs to answer the needs of their practice and thus improve patient safety.
CAE Healthcare and the Faculty of Medicine at Université de Montréal have incorporated best practices from the field of medicine, the aviation industry, and the latest in simulation technologies into this new program. A program poised to positively impact healthcare professionals and help improve patient safety, one step at a time. Join us in taking this first step.